My name is Nur Shakira Najwa binti Muhammad Nazmi. My metric number is 081640. Today, I will introduce non-ionic water-soluble contrast media, which are commonly referred to as a low osmolarity contrast media, or LOCM. Non-ionic contrast media are characterized by their low osmolarity, which is less than 3 times that of human serum. Because of their property, they are generally preferred for intravascular and intrathecal use, as they are better tolerated by patients and associated with fewer adverse reactions. Most modern low osmolarity contrast media are non-ionic monomers. Structurally, they consist of triiodinated benzene with polar hydroxyl side chains. These side chains increases water solubility while maintaining effective X-ray attenuation due to the iodine content. Example of commonly used low osmolarity contrast media include iopamidol, known as Isovoc, iohexol, marketed as Omnipeg, iopromide, also called Ultravis, Iversol or Optiway, and Eoxylin, known as Oxylin. In addition of low osmolarity agent, low osmolarity contrast media also include iso-osmolarity contrast media. These agents have an osmolarity similar to that of human serum. Currently, the only iso-osmolarity contrast agent in clinical use is iodiazanol, marked as Visipac. Iodiazanol is a non-ionic dimer composed of 2 linked iodinated benzene rings. The dimer structure allows a high iodine content per osmol, which can provide effective contrast enhancement while also reducing the toxicity and osmotically related side effects. Non-ionic low osmolarity contrast media are available in iodine concentration ranging from approximately 240 to 400 milligrams of iodine per milliliter. While higher concentration of a stronger contrast enhancement, they are also associated with increased viscosity, which must be considered during clinical use. Summary: non-ionic low osmolarity contrast media play a crucial role in a modern diagnostic imaging due to their favorable safety profile, effective contrast properties, and wide range of clinical applications.
There are 2 main strands of iodexonal available under the brand name Visipac, which are Visipac 270 and Visipac 320. Visipac 270 contains about 270 milligrams of iodine per milliliter, equivalent to about 550 milligrams of iodexonal per milliliter. It is iso-osmolar to blood, meaning its osmolality is similar to plasma and helps reduce patient discomfort during injection. Visipac 270 has a lower viscosity compared to Visipac 320, making it easier to inject, especially at higher flow rates. Electrolytes such as sodium and calcium are added to maintain osmotic balance with blood. Because of its moderate iodine concentration and smoother injection properties, Visipac 270 is commonly used for general CT scans and routine angiography examinations. For Visipac 320, it contains a higher iodine concentration of 320 milligrams per milliliter, which equals about 652 milligrams of iodexonal per milliliter. It is also iso-osmolar to blood, but has a higher viscosity, meaning the solution is thicker and may require higher injection pressure. The higher iodine content produces stronger contrast enhancement, allowing for better visualization of blood vessels and fine anatomical structures. Therefore, Visipac 320 is often selected for angiography, cardiac imaging, and studies that require higher image details.
Assalamualaikum. My name is Amna Nafisa binti Khairul Izwan. My metric number is 081734. I will be explain about the preparation step of the Visipac for intravenous procedure. For the first step, check the Visipac concentration as per requested, which is either 270 mg, which is liter or milliliter, or 320 mg, which is liter or milliliter. And then the second one, double confirm with the doctor if the contrast media is required in the examination. And then for the second step, confirm the patient's identity, which is the name, the ID numbers, and others. And then for the second step, check the patient's identity like their names and ID number, and make sure and ask the patient first about their allergic history or previous medical record to avoid any unnecessary situations. Thirdly, start preparing the contrast media using a sterile technique for all handling and administration of the Visipack, and do not use if the particle or discolorations are seen. Fourthly, warm the Visipack and administer at body or room temperature, which is minus 37 degrees Celsius, by using a contrast warmer. And do not mix the Visipack with or inject in intravenous line that containing either drugs or total nutritional administered.
Hi, my name is Nur Faisha Kosrina binti Muhammad Sahardi, and I will be continuing the video for step 5 until step 8. So for step 5, the dose and injection rate of Visipack must be individualized for each patient. This includes considering the patient's age and body weight, and the size of the blood vessel and the patient's blood flow. So we also must consider the area and pathology being examined, and the degree of opacification required, and also the equipment and injection technique used. By adjusting these factors, we can achieve optimal image quality while ensuring patient safety. Moving on to step 6, Visipack should be injected intravascularly only. So care must be taken to avoid extravasation during injection, especially in patients with severe arterial or venous disease. This injection site should be closely monitored for any signs of pain, swelling, or leakage, as these may indicate contrast extravasation. For step 7, it is important to ensure that the total iodine dose used does not exceed the recommended maximum for adults, which is around 80 grams of iodine. At the same time, the lowest effective dose should always be used to obtain adequate diagnostic imaging quality, in line with the principle of minimizing patient exposure while maintaining the diagnostic accuracy. Finally, for step 8, we focus on the patient care after the contrast administration. Adequate hydration before and after the procedure is essential to help reduce the risk of contrast-induced nephropathy. In addition, the patient should be observed for any immediate adverse or allergic reaction to the contrast following the injection, so that the prompt or immediate medical management can be provided if necessary. So, don't forget to ask your patient to drink water before and after the procedure.
My name is Nur Ali Nazra binti Azmi. My matric number is 081703. So why is the applications use Visipack? I state 3 examples for the applications. So for the first one is computed tomography or CT. Okay, so by using Visipack, we can increase X-ray attenuations of blood vessel and soft tissues. Not only that, we also can enhance contrast resolutions, allowing clearer differentiations between normal and pathological tissues, and help detect and characterize tumor and mass, inflammation and infections of organs, and vascular lesion. Second is angiography. For the angiography, it allows clear visualizations of arterial and venous anatomy. It helps identify vessel stenosis and occlusions, aneurysms, and vascular malfunctions. It can support digital subtraction angiography or DSA by enhancing vessel contrast while background tissues are subtracted. The third point is it can provide uniform vessel filling with minimal patient discomfort due to its isoosmolar property. For the last one is cardiac imaging. By using Visipack, it can outline coronary arteries during coronary angiography. It able to detect coronary artery disease, vessel narrowing, and plaque formations. Besides that, Visipack can visualize cardiac chamber during ventriculography. And the last one, reduce risk of contrast-induced nephropathy and hemodynamic changes, making it safer for cardiac patients.